In sports, few injuries are more complex than concussion. What may appear to be only a mild hit or bump can cause a concussion, and while concussions occur at all levels of sports, they occur much more commonly in adolescence. The Center for Disease Control estimates 1.6 to 3.8 million sport and recreation-related traumatic brain injuries occur in the United States each year. Among 5 to 18-year-olds, the leading causes of activity related to concussion are bicycling, football, basketball, playground activities, and soccer. Most concussions do not involve a loss of consciousness, which is why it's so important to learn the signs and symptoms of concussion. Concussions can be serious and have long-term effects if not properly managed. In Idaho, it's the law. School athletic programs must properly manage sports-related concussions in youth athletes.
The Idaho Concussion Legislation was passed in 2012, and it applies specifically to all schools, junior highs and high schools in the state of Idaho.
Under the legislation, every middle school, junior high, or high school that participates in or offers an organized athletic league must develop a concussion management protocol. The Idaho State Board of Education and the Idaho High School Activities Association are required to provide to all member schools access to current concussion identification and management guidelines. Coaches, officials, and athletic trainers are also required to review the guidelines upon employment and every 2 years afterward. IHSAA guidelines require concussion training to be completed upon hire and in each even-numbered year thereafter. There are 5 basic tenets of Idaho's concussion law. Every school that sponsors athletic sports activities must provide athletes and their parents with a copy of concussion guidelines, including the risks, signs, and symptoms of concussion prior to sports participation. Every year, schools shall obtain written consent from a youth athlete's parents or guardian acknowledging they received the concussion information and guidelines and authorizing the youth to participate in the athletic activity. During any practice or game situation, if an athlete sustains a concussion or exhibits the signs or symptoms consistent with the injury, that athlete must be immediately removed from all physical activity and evaluated by a licensed healthcare professional who is trained in concussion management. After a thorough assessment and recovery period, and only with written permission from the athlete's medical provider, may an athlete resume participation in sports. Students who have sustained a concussion and return to school may need informal or formal accommodations, modifications of curriculum, and monitoring by medical or academic staff until the student is fully recovered. A student-athlete should be able to resume all normally scheduled academic activities without restrictions or the need for accommodation prior to receiving authorization to return to play by a qualified healthcare professional. Individuals and organizations who reasonably act in accordance with the primary tenets of Idaho concussion legislation shall be afforded protection against liability in a civil action.
It's a big deal, bigger than most people think, and a little more prevalent than most people think, but hopefully through the information that we get out to the schools, we're starting to do a better job and people are starting to understand that there are a lot more concussions than have been reported in the past.
The state legislature has made that important by passing the legislation that forces us to do that. But really it's just about, we want to do what is best for our kids, and we want to make sure that our kids are safe and that when those things like concussions happen, we have done the work beforehand to make sure our kids are getting served well.
A concussion can occur in any organized or unorganized recreational sport or activity, and most occur without a loss of consciousness. Concussions are a big concern in junior high and high school sports for several reasons. First, the adolescent brain is more susceptible to concussion and it takes longer for a young brain to heal from the injury. Secondly, many Idaho schools do not have access to an on-site team physician or athletic trainer. Thus, the coach plays a critical role in the health and safety of his or her team.
Coaches know those athletes. They know what is normal. So paying attention to the athletes and being able to recognize when something is just not right, that's the first step.
Coaches are critical for concussion management. Obviously, they know these kids at a level that not many people do, and they can recognize when a concussion occurs oftentimes better than anybody else. And if they appreciate the gravity of it and they're looking out for the well-being of their team, then they can certainly make a huge difference in getting kids where they need to be.
As coaches, we spend a lot of our time, asking kids to go harder, to do it faster, to be more physical, but building that relationship with your kids so that they understand that there's a line drawn in the dirt, and that when you get to that line, it has to be pulled back. And concussions are certainly that type of situation.
A concussion is a traumatic brain injury, or TBI. It's triggered by an impact to the head or to the body that causes the head and brain to move rapidly back and forth, causing an injury to the brain.
Concussions can occur anytime there is a force that acts on the brain. It could be a direct blow to the skull, it could be an indirect blow to the body where the head deflects one way or the other. And what that does is it shakes up the brain just enough to damage those neurons.
Basically, what's happening when an athlete gets concussed are those tails or those axons of the brain are twisting and shearing. And that cellular level damage is what leads to the signs and symptoms of concussion.
While other common injuries like broken bones can be seen in X-rays, a concussion diagnosis relies on assessing the symptoms.
What's happening inside the head is at the cellular level, so there's no diagnostic test, no scans that we can do that actually detect the extent of the injury. We have to rely on what we see or what the athlete is feeling or experiencing.
The best way to identify a concussion is to watch for the different signs and symptoms, such as a change in the athlete's behavior, thinking, or physical functioning. Signs that a coach may identify include if the athlete appears stunned, is unsure of the game, score, or opponent, is confused about her position, or is answering questions slowly. Symptoms of a concussion that an athlete may report include that light hurts his eyes, he feels confused, or complains of a headache. An athlete may also report other symptoms such as dizziness, drowsiness, blurry vision, or nausea.
Most athletes, if they come out, will tell you they have a headache or they're feeling dizzy or nauseated. Those are the most common symptoms that a coach would be able to appreciate from an athlete communicating with them. There are also the signs of just recognizing when an athlete doesn't appear to have all their faculties about them. They look vacant, they're staring, they're not understanding exactly what's going on around them.
The first thing a coach should do when an athlete sustains a blow to the head or body and isn't acting right is to remove the athlete from play. Next, look for the signs and symptoms of a concussion. Remember, symptoms may evolve over the next few hours or days.
First thing I'm going to do is I'm going to talk to them. I'm going to check them, see if there's any sort of pain related, how their awareness is, and then I'm going to watch them.
If a coach notices something's not right, or if a coach is on the sideline and you see a kid get hit and you see him maybe stumble back to the huddle or stagger away from the play, that's the first indication. Remove that athlete from play immediately. Don't give them just one more down. Get them out of there right away.
If you suspect that a player has a concussion, follow the heads-up 4-step action plan. Remove the player from play. Ensure that the player is evaluated by an appropriate healthcare professional. Inform the player's parents or guardians about the possible concussion and give them information on concussion. Keep the player out of play the day of the injury and until an appropriate healthcare professional indicates they are symptom-free and gives the okay to return to activity. The symptoms of concussion continue to appear and evolve within the hours and even 1 to 2 days after the initial injury. Because of that, an athlete with a concussion should never be allowed to return to sports or recreational activities the same day the injury took place. An athlete suspected of having a concussion should not be left alone or allowed to drive a vehicle.
Anytime you reasonably suspect somebody of having a concussion, they have to be pulled out of play, number one, and they shouldn't be allowed to return to play until they've had an evaluation by somebody who's been trained in how to evaluate and manage concussions.
If a player returns to activity before fully healing from a concussion, he or she is far more likely to sustain another concussion. Always err on the side of caution. Remember, when in doubt, sit them out.
Because if you do have a second injury before that first injury is recuperated, then you're going to have a worse set of symptoms, you're going to have a longer recovery time, and you have the potential to have a more serious injury.
While a concussion is a serious injury, it is not typically life-threatening. However, if any of the following signs or symptoms are present in the absence of a qualified medical provider, consider transporting the athlete for urgent medical assessment. These red flags may indicate a more severe injury. Acute neck pain, weakness in arms or legs, severe or worsening headache, loss of consciousness or a deteriorating conscious state, persistent vomiting, seizure, increasing confusion, one pupil larger than the other, slurred speech, double vision, or unusual behavior change. Be alert for symptoms that worsen over time. Athletes that display any of these symptoms should be seen by a medical provider right away.
And realistically, I tell patients that anytime there's something going on and you feel uncomfortable with it, it's always the right answer to transfer that patient to the emergency department.
Second impact syndrome is a rare phenomenon, but it has happened even here in the state of Idaho. And what second impact syndrome is when an athlete sustains one concussion and then he or she continues to play, they are vulnerable to that second hit. And when they get that second hit, it could set off a metabolic chain of events inside their brain where basically the brain loses its ability to auto-regulate its own blood supply because it can't stop swelling, and most oftentimes it's fatal. It can be prevented. You know, that's the thing we need to understand about second impact syndrome. If we can learn to recognize concussions when they first occur, and we learn to be conservative in our approaches and not allow those athletes to return to athletic participation or return to activities that may set off that metabolic chain of events with a second hit, that's how we prevent second impact syndrome from occurring.
I think I loved most about football kind of the team aspect of it. I loved that I was part of something that was bigger than myself. Primarily played running back. Defensively, I played some free safety in high school. Graduated high school in '07, and so I came in and gray-shirted in '08. Red-shirted the year after that, and I played running back and special teams. It was late in the game. It was the last kickoff that Boise State had. I remember as the ball runner was going up the field, I really thought I had a shot to get a tackle, and so I was really just honed in on the ball carrier. All I remember is what I see on film, and he came in and his helmet connected with the side of my face mask, and my helmet flies through the air about 20 yards.
It was an incredibly hard hit. I mean, it was brutal.
On film, it kind of looks like I'm still there, but mentally, it's completely dark. And the next thing I remember is my athletic trainer standing over me, just trying to, talking to me, trying to get me awake.
I think Matt had the bad fortune of getting the big blow at the wrong time.
He did, in hindsight, the right thing. He said, "Matt, there's no way that I can, in good conscience, allow you to go back on the field." And that's when he pulled the plug on my career. I think everybody should know that concussions can happen anywhere at any time. They can happen skateboarding, riding a bike. We see them in swimming. We see them with people golfing or cross-country running. We see a lot of motor vehicle accidents and things that aren't sports related, but nonetheless, they can still have devastating effects.
The key to concussion management is physical and cognitive rest until symptoms resolve.
The timetable for which people are able to return back to their normal activities is going to be different for everybody.
In general, adolescents need more time for their brain to heal than adults. For youth athletes, the recovery process may take anywhere from several days to several weeks, or in some cases, months.
For reasons that we don't completely understand, children are sort of uniquely susceptible to concussions. That is, the brain that's developing seems to actually take longer to recover from a concussion than an adult. And we're not exactly sure why that is, but we do know that it is a factor that we take into consideration when we're treating children with concussion.
During the recovery period, a concussion can interfere with school, work, and social activities. Some patients with concussion will have difficulty with short and long-term memory, concentration, and organization.
So for me, the symptoms varied, even from concussion to concussion. It was pressure buildup in the back of my head. It was kind of sensitivity to light. I couldn't, watching game film wasn't good for me. I couldn't really focus. It was, just constant headaches throughout the day.
Every player and every concussion is different, so each student will require a detailed, individualized return-to-learn plan. Whenever possible, it's best to lighten the student's class load and make academic adjustments during this recovery, as returning to learn too quickly may prolong the recovery process. During the recovery period, it's important to emphasize to the athlete that physical and cognitive rest are paramount to their recovery. Activities that require concentration and attention, such as scholastic work, video games, and text messaging, may worsen symptoms and possibly delay recovery. However, as symptoms improve, the athlete may gradually return to cognitive activity. Once a player has returned to school full-time, has had all academic adjustments removed, and is no longer having symptoms, then, and only after an athlete is cleared by a medical provider trained in concussion management, may the athlete gradually return to physical activity. There are 6 basic steps in the Return to Play protocol. It's important to note that players may only progress one step in a 24-hour period and may only advance to the next step if there is no return of symptoms. It's critical that if any symptoms return during any step of the return to play process, the player should immediately stop all activity, rest a minimum of 24 hours or longer if necessary until symptoms resolve. Once symptoms resolve, the player may resume the stepwise return to play protocol at the last step they were able to complete without symptoms. Here are the steps of the return to play protocol. After a period of no physical activity, the athlete may begin light exercise, 5 to 10 minutes of light aerobic activity like a stationary bike or light jogging for a maximum of 15 minutes. There should be no weightlifting or high-intensity activity during this step. After 24 hours, if no symptoms return, the athlete may progress to the next step, moderate, sport-specific exercise. Limit body and head movement during this step and allow no contact. Do not advance if symptoms reappear. If the athlete remains symptom-free, the next step is non-contact exercise with more intense practice activity. You may increase aerobic intensity in this step over 1 to 2 hours. Next, the athlete may participate in a full-contact, normal practice or training activity. Finally, if no symptoms return, the athlete may return to play in full competition with no restrictions after being cleared by a qualified medical provider. At a minimum, the entire stepwise progression will take a week, but often longer in children and adolescents. Again, players should not progress more than one step in a 24-hour period and only advance to the next step if there is no return of symptoms. It's critical that if any symptoms arise during any step of the return to play process, the player should immediately stop all activity, rest a minimum of 24 hours, and until the symptoms resolve. Then they may resume the stepwise return to play protocol at the last step they were able to complete without symptoms.
Well, about 2 million concussions happen every year in the country, and they have the possibility of having significant long-term effects. And again, I think if they're managed appropriately, we minimize that risk.
The decision comes down to we don't want our athletes to have any long-term physical or health issues. Those considerations for their health and safety for the rest of their lives as young people is far more important than any short-term goal or competition.
If you're a coach and one of your receivers who usually is on point suddenly isn't lining up quite right, or he's forgetting that he's the one on the ball versus off the ball, or whatever the case might be, there's just little telltale signs like that might give you an indication that something may have happened. And sometimes if you don't see something happen doesn't mean that something didn't happen.
One of the biggest things that I see with coaches, a lot of times we're looking for a quick fix, and we're looking for products that are out there on the market. Maybe if we spend $50 more on this helmet, this will protect them more. No products out there are going to protect athletes from concussion. The best thing coaches can do is to teach proper skill progressions, to minimize hitting during practice sessions, and to create a culture conducive to reporting injury when it occurs.
The biggest benefit for us the ability to change the conversation about concussions. We don't want a concussion to happen, but if it does, we are prepared to deal with that in the best possible way.
It's all of our duty to watch these kids and to pay attention to recognizing these signs, symptoms, and behaviors. And if we notice that, we pull them out and we get them help.
When it comes down to diagnosing concussions, I mean, you know, they always say, when in doubt, sit them out. If you have questions about it, then you need to go see a doctor.